Hey, welcome back to New Day Northwest. Addiction. It's a difficult topic to discuss, but odds are somewhere in your life you've known someone with an addiction problem. I know that to be true. Eric Britt is the director of the Recovery Center at EvergreenHealth Monroe and is here to share insight into what to do if you think yourself or a loved one needs help with addiction. Again, it's touched everyone. We were talking before the segment. You said it's touched your family, it's touched mine. Talk to us what addiction is like and what it can look like.
Sure. Thanks for having me.
Yeah.
So addiction is really the compulsive use of substances despite negative social and health consequences.
Okay.
So it's often characterized by overuse or misuse of substances like alcohol, illegal drugs, or even prescription medications, and often to the detriment of a person's responsibilities or relationships.
Okay.
The important thing is that substance use disorder is a disease.
Yeah.
It's a disease, a disorder in the brain. It's not a choice. It's not a moral failing. And people from all backgrounds and walks of life can struggle with addiction.
That is a really, really important point. I want you to say that again. It is not a failing, right?
It is not a moral failing or a choice. That's right.
Okay.
It's a disorder. It's an illness.
So we have taken the shame out of it. There you have it. So how do we talk to someone about maybe a problem with addiction?
Sure. We recommend first that people are intentional in this discussion. So it often doesn't work to reactively jump in to a conversation when you're angry or frustrated.
Yeah, that's good.
It puts people on the defensive. So be purposeful. Try and choose a moment when they're not under the influence, when they're sober, and approach the conversation from a place of understanding and compassion. We encourage people not to use labels like addict and alcoholic and drunk.
Okay.
That's right. And to remember that it's an illness. It's not a purposeful choice.
And most people know already, and they're struggling. And
Sure.
if you kind of offer that lifeline, is that helpful?
Absolutely, and you want to do it in a judgment-free, compassionate way. People are inclined often to hide or conceal their substance use.
Yeah.
And that's because of the negative social stigma, embarrassment, shame, and guilt.
Yeah. What do we do when a person decides to seek treatment?
Yeah, so reach out to a healthcare professional who specializes in treating these disorders.
Okay.
Reach out to your primary care physician. Most importantly, reach out to a trusted loved one who you can confide in that will help and support you through the difficult recovery journey.
Yeah. Recovery can look different, right, for different people?
Yeah, absolutely. There's not one shape or size of recovery. Everybody's program of recovery looks different. And these days, there's a variety of evidence-based treatment approaches for addiction. So substance use disorder treatment often involves individual group therapy in an inpatient or outpatient setting. It can be support groups, 12-step cognitive behavioral therapy. We even have a variety of medications now that help people support their recovery and reduce cravings.
So it doesn't have to be scary, like you're going to be stuck in a room, you're going to be forced to talk about this.
Not at all, not at all. Recovery can be fun and social and engaging, and we really see some incredible people come out of the haze of substance use disorder and go on to do amazing things.
Do you know what I've noticed? I've never met one person in recovery who's like, oh, I liked my life so much better before.
That's right. Nobody says that.
Nobody has ever said that. Everyone I know who's in recovery has been happy about where their life is right now. So what should someone do if they want to get into contact with you?
Sure. Our website, which maybe will be posted, it's recoverycentermonroe.com, or call our front office. And basically, a licensed substance use disorder counselor will do a brief screening over the phone. They'll determine if someone's appropriate for an evaluation.
Okay.
If someone is appropriate for an assessment or evaluation, we'll have them come in for an on-site evaluation, and that'll help us determine if they meet the recognized criteria for substance use disorder.
That's kind of key.
Yeah, and then a recommended level of care for treatment.
Got it. Thank you so much for your time. I got your website right here. Check it out. If you know someone who needs help, you can learn more by visiting that website on your screen, and we have a link on New Day's website as well. All right, well, coming up, comfort, quality, style. Is it too much to ask when buying furniture for your home? Up next, Issaquah, Lucky Home in Issaquah has furniture trends that we're seeing right now. Stick around.
This portion of New Day Northwest is sponsored by EvergreenHealth.